I'm with Dr. Mohamed Adil, who is the managing director of Bangalore Bioinnovation Centre. It's an undertaking by the government of Karnataka. This is Founders Frequency on indigomusic.com in association with TiE Bangalore chapter. Welcome to indigomusic.com's Founders Frequency, Dr. Adil, and thank you so much for
Thank
joining
you.
me.
Thank you very much. Been happy to join and give my thoughts, whatever it is there on the field, what you are expecting.
All right, sir. Let's begin. Let's talk about your journey first. To begin with, you started from academia to entrepreneurship, and now you are, helping startups. And you're part of, you're heading Bangalore Bio Innovation Center. That's an undertaking by the government of Karnataka. How's the journey been for you, and what made you collaborate with the government of Karnataka for the Bangalore Bio Innovation Center? Let's start from your beginnings to like how it
So
all progressed until now.
first thing is that after my education, I just went for my education to UK. So I did my education from University of Sheffield. So I've been like looking at how people are making money in the field of research to development. So in the field
Yeah.
of healthcare, you have huge potential. Like people can become from zero to global heroes. Basically, they can be billionaires within days. So that is
Right.
how healthcare are so what you call that, like technology driven platforms which is into deep sciences. And this specific thing is into this specific innovative solutions which people are making in. So what I did is like I started my journey as a basic scientist in the field of what you call that, parasitology, which is into malarial research, and then I moved into stem cell research. And I was
Right.
actually working over there, and I came to India. I saw that people are not capable of what people are doing in abroad, but we have
Mm.
all the technology. So that's why I just in 2011 there was nothing called startup. So it was basically as businesses. So
Mm.
that was my first business which I started in Chennai and Bangalore, and that was a big flop for me, and literally lost nearly a crore. People normally don't say that they always say they succeeded in businesses. So
Right.
success is not always being celebrated. It's also the other part of success is also to be celebrated. So literally in 2011, crore is now equivalent to like 5 7 crores now in that
Right.
same business. So that was a big blow. And then at the time, I was also into this working as a product training manager and as well as the head of one of the what do you call that, regional South Indian based Della Pharmaceuticals. Now it has become a global company. It's a pharmaceutical
Right.
company where I was taking care of the complete South India, heading the more than 250 people under me and all this. So I was actually like into this entrepreneurship and entrepreneurship journey. So it has not only been only an entrepreneurship journey. So that was the key ideology what my predecessors had taught me. So always when there is a door, always try to use the door to get it opened. So that is the advantage I did. And I had two more companies which I did with RH, NHS based universities in US to get the technologies from there and get the KPI based activities done in IITs and IIScs over here. And because of certain legal issues had to stop it. That was a good one. And then I had a publication company, technology based publication company in Australia, which I started. And from India I was doing the business called Australian Journal of Medicine Dentistry. And after that I was also into this supporting the technology into media industry. So I was supporting the media movie industry for the concept of inducting the technologies for what they were making.
Right.
So I was working with the Tamil industry, Malayalam industry, as well as the Kannada industry. And before joining here, I just left out everything and came down to this position. And before to this position, I was also running a 600-bedded hospital called in Tamil Nadu called Vinayaka Missions. So I was also running 3 incubation centers, and also I'm associate professor in translational medicine and medical school.
Let's also talk about Bangalore Bio Innovation Center. You're, of course, heading it as managing director. What's Bangalore Bio Innovation Center's core vision and who does it aim to help?
So Bangalore Bioinnovation Centre is a government of Karnataka undertaking. It is under the Department of ITBT, headed by our Honorable Minister Priyank Karge sir, and supported by our Secretary of the State Department of ITBT, Dr. Ikrup Kaur. And this is one of the center which is started as the Global Millennium Policy in the year 2000, and then it was actually started in the year 2015. So from the global policy 2000. So this concept, what we wanted to do is we wanted to create the deep science innovation for people who are thinking about creating startups in the field of entrepreneurship of healthcare. So healthcare journey doesn't mean that creating digital products or only products output based on AI or ML or so on. Even bringing in monoclonals, vaccines, and deep sciences, mRNA products, and even your hospital based medicine, so your surgery products, so dental products, so even training the nurses, training the medical doctors, so everything together along with this. So this has been like the journey of BBC for from 2015, and we have been like supporting the technology advancement whatever is happening in the globe, so the for the patients needs and the growing focus on accessibility for people and affordability of biotechnology in people's life. So we have been like supporting healthcare, agriculture, climate tech and sustainability, and technology driven, basically in the mission of life sciences.
Right. If I'm a startup founder in the biotech space, how do I utilize the resources at Bangalore Bioinnovation Centre? I did do a little bit of like reading up. I know that there are facilities and like incubation centers where you could probably like set up a lab, or there's already a lab set up for you where you could do the testing and sampling of the products, which probably will take much more money if you're doing it elsewhere if you have to set up the entire lab. Other than that, could you please give us a little bit insight into how does Bangalore Bio Innovation Center help these startup founders in the biotech space to probably like expand their product and make it better or reach the right kind of market?
So first thing from your question, so normally people in the academicians are the one who tend to work out on the publications and the theses and doing the MSc projects or PhD projects. They come with an ideology of creating something. So that's how the ideology normally comes in. So but for them, creating a lab and setting up the ideology and all these things are gonna be a bomb hell load for them. I don't think investing around like crores of money for setting up labs would be feasible for any kind of normal individual. So we do have all these facilities for you. So from your equipments, for your labs, for your BSL2 facility, even corporates and companies do come and work with us. And even there are spin-outs of GCCs who are working with us.
Also, I think is there like an advantage of like better contact building or like networking or like
And I'll
uh,
give you a most important thing is BBC works as a community hub. So
right.
we have the whole community who are into this entrepreneurship in the field of healthcare journey. Based on what your ideology is, we do support you in protecting your patent, IP, copyright, and all these things, such that people should not theft it. Basically, like so, we are also doing that. And most important thing is we are also having something specifically focused on this global hub. So creating your product here and selling your product global is our unique mission of Karnataka, and from that's why we are the number one in the other states when you compare to also. And that is the mission. What we are creating here is creating things what others don't create in the world, and we export our products across the globe and creating a bigger, not just an impact in the business, also impact in the technology what we are giving to the world. So that is why we do have global companies arising out of Bangalore.
Right. What is the future of entrepreneurship in for health tech and healthcare startups? What is your vision on the future of these entrepreneurs?
I'll give you a few things. Government of India has come out with very specialized programs like Bio E3 policy, ANSR, and all these policies. And now everyone is looking behind your telemedicine, AI, machine learning, data analytics, wearable devices, 3D printing. So everyone gets these words enchant all the students and all these people around. But these are basically technologies for what you are creating for a better life of products. So that is why BBC supports the people in creating not just the technology, in utilizing this technology for medical solutions. So we come up with personalized medicine, patient engagement medicine, care coordination, and most importantly, accessibility. So most importantly, having the after the COVID, people were normally having this affordability of supporting the healthcare and all this. So we are even coming with the reducing the cost of healthcare services and creating easier efficiency products, creating smart hospitals, creating health franchise models, and most importantly, supporting in regulations. So these regulatories are very important for healthcare. And we also have this funding with government grants as well as investors. We also support them with that. And we do also help in collaboration. So overall, we shape the future of healthcare. So basically, we play the dynamic interplay of technology advancement for what whoever who wants to come here, and entrepreneurs who can be successfully navigated in this sector. So we play a catalyst for them in creating a future for outcome for the better living.
Right. My last question for the day to you is, what are the various facilities available for healthcare or startups in the ecosystem?
I'll just say about only BBC. We do have specialized equipments which are like one in India or one in one of the kind in South India and so on. So we do have analytical ultra and centrifuges, so which is like normally used for making semaglutides and all this specialized pharmaceutical formulations. And we do have analytical equipments like QTOF, triple cord, and then we do have this HPLC, GC, FPLC, and all these equipments. These equipments are not so like what you call that, these are like super expensive equipments. So one equipment costs around like 4.5 crores, 5 crores, which is equivalent to your Lamborghinis and Ferraris. So we do support this equipment's utilization at a subsidized rate for our Karnataka startups and also the Indian startups. So Karnataka startups enjoy the complete subsidy, but Indian startups have to utilize the pay and use at the market rate.
Right. Dr. Mohamed Adil, thank you so much for joining me and
Wonderful.
sharing all these insights and information. I'm sure there's someone out there who is looking to channelize whatever resources they have or whatever ideas they have within the biotech industry, who might reach out to you and who might like actually take help from Bangalore Bioinnovation Centre and from you, of course. Thank you so much for
Perfect.
joining me.
And one more thing I would like to add here is they can just go to our website and they can fill up a form, and my person will be calling you immediately.
Right. I think that's the easiest way to approach as well. Thank you so much for sharing that insight and information.
Thank you very much. Have a great day.